Hello, my name is Manoj Mammon. I'm a HealthhyU pulmonary critical care physician, and I'm here to talk to you about the flu season and COVID-19 for HealthyU for HealthyU. So this year you may have heard the buzz about the flu and COVID-19, and maybe you're wondering why is it so important now? Um, and so this this issue of importance comes into the current frame of things because how flu and COVID-19 are very similar to each other in certain aspects. In terms of the symptoms onset, both COVID-19 and the flu start about one to several days after exposure. The flu usually starts 1 to 4 days after exposure, where COVID-19 is 1 to 14 days after exposure. Um, The flu has many different strains. Right now, for COVID-19, there's only one strain of COVID-19 out there caused by the SARS-CoV-2 virus. Both of them are transmitted by respiratory droplets from an infected person. In terms of complications, uh, the flu is less likely to cause complications because it's been around for centuries, really. And humans have developed immunity over time. So, over prior infections and prior vaccinations, you have developed some type of immunity to the flu. So, the likelihood of long term complications is less. And also, acute infections and acute issues are less as well. Both of them could cause fevers and cough and fatigue, but COVID-19 more likely will cause severe respiratory complications, and they may come on very quickly because the immune system has never seen this before. Important difference between the flu and COVID-19 in terms of healthcare is that the flu is preventable. There's a flu shot available that can help prevent the infection risks from the flu, and also any type of severe symptoms from if you do happen to get infected with the flu. In terms of prevention for COVID-19, as we all know, it's the only real prevention right now is self-isolation with social distancing and masks um, if you cannot social distance. And because they're very similar in presentation, you may go to your healthcare provider or the healthcare system when you have symptoms of the flu, and that may overwhelm the healthcare system. And so, to prevent that, this is one of the reasons why we want to make sure everybody understands why it's so important this year to get the flu vaccine. So, how does it protect someone, the flu vaccine? Well, the flu vaccines have been used to prevent flu infections and severe flu symptoms since the 1940s, really. The initial vaccine used fertilized eggs, chicken eggs, in a method that's really still used today to produce most of the flu vaccines. So, what really is in a flu shot is killed flu viruses for most of them. And it's an inactivated vaccine, is what it's called. There's some newer vaccines methods that can make flu vaccines without the flu virus at all. They use some newer methods of taking the proteins from the flu virus, and they're called recombinant vaccines. So, what happens when the flu shot with these inactivated viruses or proteins are injecting your body is that these uh, uh, components allow your body's immune system to recognize characteristics of the particular flu strain structure, and then your body will then develop antibodies against the flu. So in this picture here, don't go into the deep science behind it, but the flu vaccine will make your body produce these antibodies that then recognizes the viruses here in this circular structure here that prevent its infection of cells and allows your immune system the chance to capture and kill the flu virus. Usually, The flu vaccine can cause your body to develop antibodies around 2 weeks after vaccinations. And it's usually protected against the flu strains that are in the vaccines for approximately 6 months. Um, in this little graphic here, it's on the side, the CDC, the United States CDC, spends a lot of time and effort to test different patient specimens to see how many flu viruses are out and circulating in people, and does a full genetic sequencing to determine which ones that should be included for eventual vaccines. And then the CDC works with flu vaccine producers, private companies to develop the actual vaccine for people based on the best strains that are likely to circulate and infect people the upcoming flu season. So, in terms of how does it protect everyone? The flu actually is year round. The flu virus is infecting people year round. The issue is the heaviest flu activity starts around November and lasts until March. So the best time to get the flu vaccine is September, October frame. This week, if you haven't gotten the flu vaccines, it's a good time to get it. Every year, the flu vaccine prevents illnesses, medical visits, hospitalizations, and deaths. And they know this because there's times in the past where the flu vaccine may not match the strains that were circulating, and they saw a huge increase in medical visits and hospitalizations and unfortunately deaths. And in this year, in this season, we want to make sure we conserve the resources and the energy of the folks in the healthcare system, and making sure that we have enough capacity for any COVID-19 surge. And by enforcing and encouraging everyone to do flu vaccines this year, this will help prevent flu illnesses and also help preserve the capacity of the healthcare system for those illnesses and diseases that are not preventable. So anytime I see the change of color in the leaves or the fall sports, I'm thinking, hey, this is time to get the flu vaccine. The next question is, that I've been asked is who should get the flu vaccine? And recommendations are that nearly everyone over age of 6 months should get the flu shot. Although younger individuals less than 18 and really less than 5 years of age, and people over 65 years of age, and those with any type of pre-existing medical conditions are most affected by flu, nearly everyone should derive some benefit from the flu vaccine. Basically, you should consider the whole family to go ahead and get the flu vaccine. And I strongly encourage that because if you have family members who have pre-existing conditions or under age 18 or over age 65, and you're not in those risk groups, if you get the flu vaccine, you're less likely to spread the flu to those individuals in your family that would be most severely affected by having a flu infection. So when you think about it, it is a very good recommendation for everyone in the family to get the flu vaccine because it protects the most vulnerable in that family group. Another popular question that I've received from a lot of patients is with the flu vaccine is can you still get sick from the flu vaccine? Or can you get sick from the flu vaccine and can you still get sick after you get the flu vaccine? So the flu shot is made from killed viruses. It's a very thorough and comprehensive process that the CDC monitors, the FDA monitors these companies and making sure that it's a killed flu virus in these vaccines. And also there's different vaccines that only have the proteins from the virus and not the virus itself. What the concern is, it takes the full immunity only will occur around 2 weeks in individuals. So that means that for the 2 weeks from the time you get the shot to the time that you get full immunity, you could potentially get flu infection. And that's why it's important to get the flu shot this season at this time as opposed to waiting later in the season because you could uh, potentially get infected and get the flu shot after you get infected because there's a latency of how much time you get full immunity from when you get the flu shot. Now, when you get the flu shot, you could get pain and redness at the injection site. You could get a headache or muscle aches uh, for 1 to 3 days, and this is really your immune system is ramping up antibodies and in reaction to the flu vaccine. It's not an actual flu infection, and these symptoms are much uh, 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 smaller in intensity than the actual flu. So there is a local site reaction with the flu vaccine, but this is much minor compared to the actual flu. And it's not that you get the flu, you got a local site reaction. So just to clarify for those, you cannot get the flu from the flu vaccine, but you still can get sick because there's a time lag before you get full immunity from the flu vaccine. And there's also certain issues with an individual's immune system may make you less likely to get full immunity, but it's still the best way to prevent the flu vaccine. The flu vaccine only works against the flu. It doesn't work against other viruses and pneumonia. So I have told my patients you probably got another type of virus infection or another type of pneumonia and not the flu. And even if you got the flu into your body, and even if you have an immune system that doesn't have a great response to the flu vaccine, you have significantly less severe symptoms and fewer complications, um, and less likelihood of going into the hospital or the healthcare system. A recent question I've been asked about the flu is why are there different doses? Well, there's the regular dose, higher dose, and adjuvanted flu vaccines. Adjuvanted flu vaccines are basically an additive added to the flu vaccine to make it a more potent inducer of immune response. Those types of vaccines are available for those over age of 65. The reason why those different doses and types of flu vaccines are available is because those over age 65 are higher risk of developing serious complications from the flu compared to younger healthy adults because the immune system changes over time. Like the outside of us, the inside of us also changes over time. And the immune system is one of those parts that changes and may reduce our response to the flu vaccine. So maybe a higher dose or a adjuvanted vaccine is necessary to make our immune system have a robust enough response to provide protection. The CDC doesn't make a recommendation between the different types of doses, but most primary care doctors and most pulmonologists I talk to would recommend a higher dose or adjuvanted flu vaccines for those over 65. And one of the last questions I received is where can I get the flu vaccine? And actually, this is one of the easier questions to answer because there's many places to get the flu shot. Health has many locations throughout the Western New York area. The best location to find all that information is kaleidohealth.org to look for the schedule of Kaleido Health flu vaccine clinics. Another helpful website is the vaccinefinder.org website that's sponsored by the US government that has different sites available based on zip code. And if you're going to see your primary care doctor, then definitely go ahead and ask them if they could provide the flu shot. So, in terms of questions we received, uh, is can you get the flu and COVID 19 at the same time? And yes, you can get the flu and COVID 19 at the same time. Like other viruses, you can get infected with at the same time as the flu. You could get COVID 19, which is just another virus, along with influenza. It's unfortunate, It's not something we want people to get, and obviously that's something that we want to prevent with the flu vaccine. There's a question: does the insurance cover the vaccine? This is something that I actually investigated for my patients, and every insurance will reimburse and cover the cost of the flu vaccine, whether it's Medicaid, Medicare, the commercial and health insurances, the Medicare Advantage programs. So nearly, so every health insurance company will cover the flu vaccine. Um, if I get the flu, do I still need to get the vaccine? So when we talk about the flu vaccine, there's four different strains of viruses that are included in the flu vaccine. And even if you got the flu, you probably got one strain of the flu in the season, and you still could get and be unfortunate and get another strain of flu later in the season. And I had a couple of patients who were unfortunate to get that. So even if you got the flu, I would recommend you still get the flu vaccine because there's other strains that may be circulating that you would want to be protected against. Um, Another question is: does the vaccine protect you against any of the COVID symptoms um, or even the virus? And no, the flu vaccine does not protect you from any other viruses besides the flu, and no other symptoms of COVID 19, if you got infected with COVID 19, will be affected by getting the flu vaccine. We would hope that's the case, but unfortunately, no. It's specific protection just against the flu. Overall, the reason why to get the flu vaccine is so you don't get the flu. And you don't want to get the flu this season because you don't want to get COVID 19 and the flu at the same time. And two, if you get the flu, it may be hard for you to understand or to determine by yourself if you have the flu or COVID 19. Even a healthcare provider may not be able to tell that unless you go through testing and some type of interaction with the healthcare system. And when we have issues with uh, resources in Western Europe, we don't want to overwhelm our healthcare system with folks who have the flu who are unsure if they have COVID 19. And by focusing on our energies and everybody getting the flu vaccine, that way we have, as a society and a healthcare system, enough resources for those who are sick for other diseases and other illnesses during this pandemic health emergency. So I think this is the end of the talks. I thank you very much for joining us today, and definitely look at kaleidohelp.org for any further information about the flu vaccine center or site closest to you.